So now that you know how we diagnose TOS in our office, I want to talk to you about how we treat it. Now, we are a chiropractic office, so our job here is to make sure all the joints are moving well. And we know that TOS is a complaint of neck issues and a little bit of chest issues as well, right? So what we'll do is first is we'll make sure his neck is moving well. So we'll definitely adjust his neck. In addition to adjusting his neck, we'll adjust his shoulders since the brachial plexus is involved. We can adjust the clavicles up here, and we can adjust the ribs as well. As far as the soft tissue stuff, we definitely want to work on these scalene muscles that are usually right about here in his neck. So typically, I would get a Grassin tool and work on that. But as you can see, this is on the anterior side of his neck, and I don't want him to have any rashes or burn marks here, and people look at him strangely as hickey. So what I would do is I would just simply use a little bit of my cream and just do a little bit of myofascial release through here. Just work that muscle, break up some of that scar tissue. I'd also go right through here in this costo-clavicular area, and I'll do a little bit of pin and stretch on this area here, just to kind of loosen that up for him. In addition to that, I will do a little bit more aggressive stretching on the muscles of the neck. And that would help with the neck component of his TOS. If the TOS is more involved in the chest or pec, we definitely have some tools to work with that. So to be kind to him, instead of scraping his chest up, we do have our blunt tool here, where we can just kind of work through this muscle as well. Just kind of loosen this up, break up some tissue adhesions through here, let those nerves and vessels flow easily. In addition to that, we can do a little bit of dry needling on his chest as well. Now, dry needling for the chest is very difficult, so you definitely want to make sure you go to someone who knows what they're doing, is properly trained, because his heart and lungs are right through here. So if we use the wrong needle or wrong technique, we can create more problems for the patient than they need. So I'll show you how we do dry needling for the chest here. It's pretty quick and easy, very simple in our office. We'll just go ahead and do a little pinch of his pec muscle, lift it off the bone here. We'll take our needle, put it through, and just work in the area that we have pinched off, just to make sure we just get a little bit of release through that muscle. That should be relatively painless for our patient and help them feel better. So now that you guys have seen what we do to treat TOS in our office and how we evaluate it, in our next video, we're going to show you exercises and stretches that you can do at home to help yourself if you're having TOS and make yourself feel pretty good. We'll see you in the next video.